Welcome, everyone. We're excited that you're here today. I'm Dr. Jennifer Salerno, a nurse practitioner, mom, and founder of Possibilities for Change. As a clinician and former director of the University of Michigan School-Based Health Center program, I saw firsthand how we identified risk, but then failed to connect that to meaningful help. And that was really difficult as a provider. So, over the past decade, I brought together an incredible network of educators, clinicians, software engineers, parents, and youth to really flip the script and change that. Together, we've created a system that turns screening into action, helping youth save helping youth live safer, healthier, and more successful lives. So, welcome. So, I'd like to start this webinar by hearing from one of our athlete partners, really helping to elevate the problem we've set out to solve. Really, that critical gap between screening and then what happens afterwards that makes everybody feel anxious and really inspired this work.
Every day, there's a silent crisis unfolding in our schools. A smile hiding sadness. A student battling invisible storms. And far too many feeling like they're alone. 1 in 3 youth feel hopeless. 1 in 6 have made a suicide plan. 1 in 4 don't have a trusted adult to turn to. Just let that sink in. Now ask yourself, what if we could change that? This is Rising Together, a bold movement to rewrite the story for our youth. To give every student a voice, a safe space, and a lifeline before it's too late. As a father, I know what that means. With our school-wide mental health screening, we're not waiting for our kids to cry for help. I wish I would have got to my son. I wish I could have heard his silent cries. But now I need all of us to reach out first. Identifying the needs, like having real conversations, connecting them to real support to where they can get help. Because we believe mental health support should be just as common as math class. Together with our partners, we're on a mission to help 1 million youth live safer, healthier, and more successful lives by 2026. And now, this is me personally. We need you. Whether you're a parent, a teacher, a coach, or someone who just cares, be the difference. Be the trusted adult. Be the reason a child chooses to keep going. They're not alone, not anymore. Let's rise together.
Ray's words are so powerful. He's just had such a great way of elevating the message and what we're doing. He really reminds us that change is possible, but only if we think and act differently. So, across schools nationwide, we've seen what happens when screenings identify risk, but stop there. So, we're here to kind of change the script of that. So, let's talk about that gap. Most school-wide screenings do an excellent job identifying which students are at risk, but then the process stops. So schools are hesitant about wanting to participate in screening because schools and families are often left without knowing what to do for follow-up, without that connection, without that care coordination. One of my favorite quotes from a school partner in Colorado, you can see on the slide here, says, "Screening captured some of the quieter kids, the ones who seemed fine on the surface, but had so much going on underneath." And that's exactly what we're trying to do and who we're trying to reach, those students that otherwise would have gone unnoticed. And that's why Rising Together was built differently, to fill those gaps and support not just the students that are, screening and we're identifying as at risk, but all of those adults, all of those networks that care for those students. Rising Together is a comprehensive evidence-based program. It was designed for youth ages 8 through 18. So schools, it's typically 3rd to 12th grade students that are part of our program. What Rising Together does is it empowers students to be open and honest with the way that we present the screening and information afterwards. It identifies those students at highest risks immediately. And then it also takes that next step and equips both families and schools to respond right away. And that's the piece that's most important. Like I mentioned earlier, it's built over a decade of measurable results. And that data shows real improvements in youth well-being over time. One of our prevention specialists put it perfectly: be prepared for immediate results, and that's not necessarily a bad thing. When we talk about early intervention, that's exactly why this program exists. It's not just about the technology or the screening, it's about giving young people a moment to be seen, heard, and supported.
One of my clients who I was already seeing for therapy, she flagged as high on the survey. And then she's like, if this would have gone out when I was in middle school, like I would have gotten help a lot sooner. I'm glad that the school's doing this survey for everybody.
And that one statement really defines our mission. Rising Together ensures that no student has to wait for help. Like that student shared with the counselor, she wished that she had gotten help sooner. Hearing that and just knowing that there's so many students that need help, a lot of times people think, okay, what does this look like in action then? So let's walk through that student journey. So what happens is a student comes to school for the day, receives a link to complete a screening during a designated class period. Typically, they're using their assigned computer or tablet. Their teacher is giving them direction. The questions are private. They see one question at a time. They're engaging. We built the technology to really provide that safe space and encourage honesty. So from there, if a student's response indicates concern, our ADAM technology flags that student in real time. That triggers a supportive process that we've already been working with schools to ensure that they feel comfortable with. Students meet with designated school staff and they're provided immediate interventions. Then families are contacted when appropriate by those school support staff. And if needed, personalized community resources and referrals are facilitated. And these referral agencies that the schools are reaching out to are identified, and those partnerships are established prior to any screening occurring to help ensure that those connections are seamless, because that's the piece that is missed most often and that schools are most worried about. So as you can see, the process itself is fairly simple, but the impact runs really deep because behind every screening that's completed, every flag that's reviewed is a real student whose life can change literally at that moment. And that's exactly what we're seeing, that student improvement across schools. So when we talk about outcomes, it's easy to focus on numbers and metrics, and we definitely have those. That's a piece that I'm really interested in. I love the data and seeing the impacts. But the real proof is also having that voice of students. And one of the stories that you can see here stays with me and came from a school partner who said, we identified a student who had been dealing with suicidal thoughts, anxiety, and depression for years. He didn't know how to ask for help. And that is a real barrier for youth. They just don't know. Even though they see messages, they have people tell them, they don't know how to disclose what's going on. And then they want help. They want to ask for help. So for this student, he didn't know how to ask for help. But when he was approached after the screening, following that process, he finally opened up and he told us he probably wouldn't be in therapy today if it weren't for this screening. So that's a really powerful story from a student, because it's not just about identifying risk, it's about opening that door for him, for his family, because I'm sure they were seeing a lot of those symptoms as well. And every time I hear stories like this, I'm just reminded that what we're building is more than just screening. It's a program, it's a pathway. What we're trying to do is really open that door to hope, to connection, and care for those students that might be struggling in silence. And for us, the hope doesn't stop with students, it extends to their families and the trusted adults who surround them, because that's one of the biggest protective factors. So, a big part of our work includes empowering those parents, caregivers, and mentors through the incorporation of our TeenSpeak program. And TeenSpeak gives adults practical communication tools that are rooted in motivational interviewing. And those are skills that help parents talk through those tough situations with their teens without judgment. And that can be really challenging as a parent. Parents often tell us how transformative it feels when they've learned some of those skills and strategies. One said, I suspected my teen was struggling, but this helped me finally know how to address it. And as a parent, that can feel so good to feel like, okay, now I have some ways that I can connect and really understand what's going on with our teens. And the data for parents show the impact as well. Nearly 80% of parents reported feeling confident, having difficult conversations, and over half felt more connected to their teen after going through the TeenSpeak program. And that connection is really what builds that resilience. So, what makes Rising Together stand out from other school-wide screening programs? Let's look at what truly sets it apart. Rising Together combines evidence-based tools with cutting-edge technology and real human connection. So our platform supports students throughout the screening process. Like I mentioned earlier, making it feel safe, honest, really empowering students to share what's going on with them, share their voice. Schools receive full implementation support through our team, crisis guidance, and ongoing coaching. Families get personalized feedback and easy to use resources. Whether or not they participate in TeenSpeak, they get a lot of information, feedback, and resources. And then on the back end, leaders gain access to population-based real-time analytics that track trends of their students, outcomes, and then that long-term improvement that we see in depression and anxiety symptoms, and also students that are contemplating suicide. We're not just identifying risk, we're responding to it, and then we're measuring the difference that it makes. And that's a key component to our program as well. So everything we built, the evidence base, the technology, the training that's involved, it all comes down to specific moments. And this next story comes from one of the counselors using Rising Together in her school over the last year. And what she shares is a powerful reminder of how one screening can truly change everything.
I had a sixth grader who is in therapy outside twice a month, and it turned out that she had been making preparatory steps. She was writing letters. She was definitely looking at and moving forward with wanting to attempt. If we didn't have this screener, and this is where I get a little emotional, but if we didn't have this screener, I don't know what would have happened because she wasn't being truthful. And in that situation, she clearly was open and wanted help and was open to what she was feeling and experiencing. And so I think in those situations, that's why we do the screener right there, because we just, in my heart, we saved her.
And just like Stacy shared, stories like that are why we do this. Every single screening has the potential to be that turning point for students. And what's so powerful is that I've heard this same story from many counselors across different schools. It's not just happening at the school that Stacy was in, it's happening nationwide. So the Rising Together National Partnership Model brings that vision to life. Everything that I shared related to, what Rising Together is, how we're different, how that looks in a school. We're really bringing that vision to life and uniting multidisciplinary experts the cutting edge technology, and passionate advocates. It's such an important piece. You heard Ray's story already in his kind of advocating for more screening and rising together. So from schools, clinicians to healthcare agencies, nonprofits, and athlete foundations, we're all working towards one shared mission to rewrite the story for our youth. It's that kind of passion and collaboration that's fueling our success. And one of the best examples of this collaboration in action is our work in Colorado. So that brings me to Colorado. The Behavioral Health Administration has partnered with us to implement Rising Together across middle and high schools statewide, first with legislation and now with grassroots community support. And I'm really excited to be joined today by Elizabeth Schwemmlein, who has been an instrumental leader in making this work a reality across Colorado. Liz is the program administrator at the Colorado Behavioral Health Administration and has led this initiative in its earliest stages, from policy to on-the-ground implementation. She's worked side by side with our team, Colorado schools, and community partners to ensure that mental health screening is a meaningful part of how schools care for students every day. So Liz, thank you so much for joining us and for your incredible leadership. I'd love to start out by asking you to share what's made this work so powerful in Colorado and why you see school-wide screening as such an urgent priority.
Of course, thank you. I'm excited to be here. Excited to be talking about this important work. Mental health screening school-wide is important for all youth. Early identification and intervention of mental health needs improves outcomes for students. It's proactive and preventative, and it's a process that really helps to normalize discussions about mental health and reduce stigma, and it provides resources and support to young people and their families. Positive mental health and well-being has been associated with student readiness to learn and academic and lifelong success. It's a super important part in my view as how we're able to educate and support the whole child within an educational setting. As far as Colorado specifically, we have a survey that goes out every other year. It's called the Healthy Kids Colorado Survey. It goes out to all middle and high school students in schools that elect to participate. It's Colorado's most comprehensive data source for understanding how our youth are doing. It had about 100,000 participants last year, or in 2023, which was the last year it was implemented. And that survey indicated that in Colorado, 42% of high school youth believe that their stress levels are unmanageable. 17% of middle school students had seriously considered suicide. 26% of high school youth reported persistent feelings of sadness. In addition, unfortunately, suicide continues to be one of the leading causes of death for our youth in Colorado. So all of this indicates that we really do need to provide behavioral health support. And this need combined with Colorado's kind of unique limited access to mental health care, particularly for youth and families in our rural and frontier areas, makes it really crucial for schools to be a part of the process in identifying needs and working with families to connect them with necessary mental health resources. Many schools themselves, unfortunately, in Colorado, probably also nationwide, are very under-resourced with both workforce and finances to be able to provide a comprehensive mental health screening program. And that's what makes it so important to be able to provide some of these legislatively or grassroots movements to give them access to a screening program like this that includes technical assistance and support with implementation and intervention.
Thank you, Liz. I appreciate how you highlighted what's driving the work. The statistics are just so sad when you look at, everything else that's happening and how that can really impact academic success. So we didn't really bring that piece in today, but there's a lot of research around looking at and identifying mental health and how that really is a driver to increase attendance and increase test scores and all of that sort of thing. So decrease disciplinary referrals. So it's really, that's an important connection that we didn't talk about earlier. So let's talk a little bit more about what it looks like on the ground. So some of the impacts that we're seeing on students and schools and our entire community, basically. So what are some of the things that you've observed in terms of impact of this program over the last year as we've gotten it off the ground?
Yeah, I think what we really found was that it created, and I think you mentioned this earlier, a pathway, just this pathway to discuss mental health, remove that stigma of these discussions, equip adults with the skills needed to have these discussions, really provide an inroad for schools to engage parents to support youth mental health as well. Parents were grateful that it opened up conversations with their kids, especially those who reported that they had suspected a mental health issue, but they just weren't sure how to address it. So again, giving them that language, empowering them to discuss really tough topics with their kids, but very important topics. The staff were surprised at the schools that we conducted the screener in. They were very surprised at the number of students identified as having mental health needs that were not already identified as being at risk. They weren't already connected with a counselor. Oftentimes, the counseling staff and the admin will say, hey, we know who our kids are that we need to worry about. And this really showed that they didn't know all of the kids, and there were some that were just not on the radar. The screening really allowed staff to develop supportive relationships with youth and their families. Again, that connection and support, and to have a list of resources at the ready was also very important to staff. It was really a catalyst to connection, support, and increased student engagement and success across the board in the schools that implemented this program. And I think, what you said earlier, Dr. Salerno, about hope, connection, and care, that really summed it up.
Mhm. Yeah, same. I think what stood out to me is all the things that you shared, like not only the difference the screening made for individual students, but how it really reshaped how those schools were thinking about who was at risk and just mental health as part of their culture.
Mhm.
So we know that none of that happens without strong collaboration. Let's talk just a few minutes about what it took to make that possible, like how we partnered together and what were some of those ways that we brought the program to life. So we worked very closely together over the last year and kind of getting all of this off the ground.
Yes, and I would say that I wouldn't say completely seamless, obviously, but I
Yeah.
think that our collaboration certainly was, our ability to form connections and rapport with the school staff. I think possibilities for change was very available and made it a priority to be available for the administration and the staff members who were, absolutely understandably a little worried about, what are we going to uncover with this screener? But trust was really fostered through the team effort to listen to school staff concerns about capacity to respond to the identified student needs, particularly those identified in the high-risk categories, requiring that quick or immediate intervention. Possibilities for change and BHA through our collaboration together really help staff feel supported. And we enlisted the help of the Office of School Safety's Crisis Response Unit in Colorado to be able to assist and to provide kind of that safety net that really helped staff feel that they were going to be supported if there were, any type of crisis mitigation or management that needed to be happening after the screening occurred. And thankfully it wasn't necessary, but it certainly helped folks to feel more comfortable administering the survey. Our collaborative efforts really yielded positive outcomes, and it was very I think just that fostering trust with staff was extremely successful. And I think that folks who administered the program last year would be happy to join again and administer again this year because of that trust that was formed in that rapport. We were able to really work together to compile some meaningful national, state, and local resources to support youth and families, as well as you had mentioned, Possibilities for Change offers psychoeducational and motivational interviewing resources for staff and parents, which really does help them to develop those skills that work to help them support, their own youth that they're the caregivers for, but also the community at large.
Yeah, absolutely. It was an amazing opportunity, really, to work with you, the team at BHA, and also all the different resources, the Office of School Safety, and really kind of dig into how to, like you're mentioning, build that trust and help schools feel supported. It really reinforced what was possible when we look and unite everybody around that same purpose. So thank you again, Liz. I want to leave everyone with an invitation to keep this momentum going, to bring this work to your schools and communities, to be a part of a movement that's really changing the future of youth. As you heard from different quotes that we had and other things, we really try to look at all of the different ways that we're impacting schools, not just identifying risk, but really supporting and equipping schools and families with skills and resources that they need. So Rising Together is more than a program, it's a call to action. That's why we're calling it a movement. So every school, every district, and every community has a role to play in helping youth live safer, healthier, and more successful lives. That's really our tagline. So if what you've seen today resonates with you, if you believe in those same things, we invite you to join us. So whether you represent a school district, a foundation, a healthcare organization, or you simply just care deeply about young people, there's a place for you in this movement. Click on the QR code that you see here on your screen, or Mackenzie's going to put a link in chat to stay connected with us. We'll send out information about what's going on, different ways that different schools are working with in different states and different events. So if you want to stay connected with us, you can do so in those ways.